Okay, we are ready to go here, and I would like to welcome everybody to our last virtual town hall for the 1920 school year, something that was certainly not anticipated, but has worked out really well in terms of a way for us to provide information, answer questions, and get together every week. We'll continue to do this. We'll launch some of these during the summer and get some dates out to people. It won't be on a weekly basis, but certainly we would like to connect with people over the summer as well, especially as we start to move towards deeper conversations about school reopening, something we'll certainly cover today also. And then we'll utilize this format again next year too, so that people have this opportunity to engage in a different format and in a way that seems to have been very convenient for them. I'd like to start out today by welcoming our guest, Dr. Michael Mendoza. Dr. Mendoza is our Monroe County Health Commissioner and practitioner here in Rochester, and of course, a very proud Brighton parent also. Mike, thanks a lot for joining us.
My pleasure, Dr. McGowan.
So today we're going to start out having Dr. Mendoza talk a little bit about where we started with all of this in terms of COVID, where we are right now, where we might be heading. And then we'll dig into your thought exchange feedback. We got a ton of feedback and really appreciate that. We'll go through as much of that as possible and then finish up the way we have every week, which is using the Facebook Live comments too. So if you want to follow up and have additional questions, feel free to throw them in there. So Dr. Mendoza, the floor is yours. What is on your mind? What happened? Where are we right now? Where do you think we're heading?
Well, first of all, thank you for the invitation. It's a pleasure to address my fellow parents and my community here in Brighton. This has been, by every measure, an unprecedented, 3 months now. Feels like longer. And I will say that, we have managed so far to avoid the worst. We have flattened the curve, and we'll get into a little bit about what that means. But I think where we are now is really looking ahead. I think from the health department standpoint, we have gotten past the scary part, the first scary part, and now we're looking ahead to trying to reopen, because at the end of the day, we do not want to go back to where we were in those darker days of March and April. And I will also say in the same breath that we're not out of the woods. There's a whole lot of work that we have to do together as a community. And what gives me great hope is that we demonstrated that we can get to this point because of the collaboration and the communication across Brighton, across the rest of the county. If it weren't for the level of collaboration between all of the different parts of this county, we wouldn't be enjoying the success that we are in. And I don't mean to say that it's all been successful, because by every measure, there's been a whole lot of heartbreak and a whole lot of destruction, particularly from the economic standpoint. And our kids have gone through a whole lot. And as I look ahead, as I lay out for you, hopefully some guidance in terms of how we think about the health risks, I have to share that I'm also very much, if not more, worried about the socio-emotional developmental risks that our kids have gone through, the challenge that we're going to have to figure out together how to get them back into school. I often say that it was very easy to close schools down on March 15th. We saw a problem. We had a lot that we didn't know. We turned the lights off, we closed the doors, and we just sort of watched. And now that we've done that, we know how hard that is. I don't think we'll be in a position where we're going to have to do that again, quite frankly. My hope is to completely avoid that as best as we can, but that will take some work. And we can talk about what an outbreak in the fall might look like. But what I would first like to lay out for everybody is when I look at the health aspects, the public health aspects of reopening schools, there are really 4 or 5 perhaps principles that I think have to be part of every equation. The first is masks. The second is social distancing or physical distancing. How do we achieve that 6-foot distance between people if possible? Hand hygiene is going to have to be a part of every plan. Surface disinfection. How do we clean the desks, the doorknobs, the handrails, the stair, all the things in our buildings that need to, be attended to. And then there's the giant question of screening at the door. What kinds of procedures will we need to undertake when we look at screening individuals entering every building? I don't believe that one size will fit all, because when you look at the buildings, you've got different ages, obviously, you've got different physical layouts, you've got different staff. While I think it would be great to have a general guidelines across the district or across the county, I think the reality is that each building will have to look at these guidelines and to some degree tailor it to them. And it may be that all primary schools across the county will have more similar sort of guidelines than, say, Council Rock will to TCMS. because of the age. So to get into a little bit of the detail, K through 3, for example, would be very easy, or much easier at least, to keep in one room, as opposed to high school, where it's probably impossible for them to stay in one room throughout the day. And so the nature of the interactions between students, the nature of interactions between students and teachers will inherently be very different depending on the age. Transportation is another whole big question mark. We've got to figure out how do we bus in an era of social distancing. So what I will say as we look ahead, given that there's still a lot that we're learning, I do think that when we look at risk, when we look at the various phases as they've reopened over the last several weeks, I think one principle has become very clear, which is that there is no single way to look at risk. I think people have this desire to want to have a rule. And I don't think that there is a single rule. And I don't think that there is a single way to get through this that absolves us of all risk completely. Every interaction is going to, have some degree of risk. And I think to the extent that people want some security, I think that security will come in being able to measure that risk, understand that risk, and apply their own judgment, because inherently we're all somewhat different in terms of our desire to invite or avoid risk. So when I think of interactions, I think that the main challenge we have here is that we've got a respiratory virus that's transmitted primarily person to person. We've talked a lot about the fomite thing, the droplets on the counter, and you touch them and then you touch your eye. That is still on the table, literally, but I don't think that that's the primary way that this has been transmitted. I think the primary way this virus has been transmitted is person to person. So when we look at that person-to-person risk, I want us to start thinking about that risk on 3 sort of dimensions. Number 1 is proximity. How close are you to another individual? We know that anything beyond 6 feet is really very low risk. Anything less than 3 feet is much higher risk. So that 3 foot, even between 3 and 6 feet, there's probably a fair difference there in terms of risk. Less than 3 feet is much more risky. And we know this because we've seen this. The medical professions in general have been largely spared given how much they've been exposed. But we know that anesthesiologists and ophthalmologists, because they're literally in your face, have the highest risk. It has to do with that proximity. The second dimension of risk is duration. How long are you with somebody? We have not found, to our knowledge, any evidence of transmission between people who are passing in the aisles at Wegmans or passing, on the street running, because that duration is just too short. There isn't enough time there to exchange those respiratory droplets from person to person. So, in the health department, we consider anything greater than 10 minutes as being more risky than anything less than 10 minutes. But obviously it's linear from there. 1 minute is much less risky than 5 minutes. So to the extent possible, we want to limit the duration of interactions whenever we can. And then the third dimension of risk is activity. And this is probably the hardest one to estimate, because this gets into literally what are you doing? This is where we say hugging and kissing is probably more high risk than the elbow bump, although there's some evidence that the elbow bump is a little risky as well. What are the people doing? Are they yelling? Are they singing? Are they whispering? We know that choir, unfortunately, anything involving wind instruments in a musical sense is much more risky than a string instrument. That's because of the nature of the activity. So it's proximity, duration, and activity. Those are the dimensions that we want to be thinking about. And this applies to going to a restaurant. The reason why it's relatively safe for you to go with your household to a restaurant and sit less than 3 feet apart is because you're all in the same household and you've all shared your risk up until now. The activity in that sense is very low risk. So the fact that you're in close proximity for a long time is relatively trivial. So that's the way we want to think about all of these interactions. And I wish there was a simple rule, but I think that's probably the best way to distill the risk. As we go ahead, what I will share first of all is that I'm looking at in the next couple of weeks, convening a small task force across the region that looks at the health-related parameters of reopening schools. We believe there will be guidance coming from the state, and we also think that it's probably not going to be that detailed. So I want to get infectious disease doctors, public health professionals, nurses, school nurses, people who can really comment on the masking, distancing, hand hygiene, surface disinfection issues that pertain to a school. I'd like to try to find just the best, collection of evidence that we possibly can, just to give that to the schools going into the summer, because a lot of planning and purchasing has to happen between now and the fall. So with that, I guess I'll just pause and hand it back over to Kevin, and then we can jump into the questions. These are great questions. I would love to get to all of them. I know that we won't, but let's try to do the best we can.
Yeah, absolutely. I think so. And I think we're going to cover a lot of what might be on people's minds and some of the follow-ups that I would have just by answering some of those. Off the top of my head, though, I'm curious. I think this is really interesting, actually, probably for the people watching. I like to think it's interesting for people watching that in our two professions, these are conversations that we are having professionally with a large group of superintendents, and people are now community members getting to watch you and I have the same kind of dialogue, which people should know this is exactly the kind of discussion we have, which I think is important and kind of neat, I think, for people to see, but they probably have better hobbies than I do. I would say this, though, one, I know you can't commit to anything now, nor can I. So a lot of this conversation is in the hypothetical as we try and figure out what the state health department is going to tell us, what the governor is going to want to do, what the state education department is going to want to do. So it's two guys slinging ideas back and forth, although I'd give you a lot more credit than me because I think that you have far better knowledge about this. However, I want people to know that we can't commit to anything now, but we're just trying to think through it in front of everybody, which has the risk of people thinking we're committing to something. But I think it's good for people to know we're brainstorming. To that end, what I'm wondering is what your thoughts are around, for example, athletics. Can that happen? Can that not happen? What do you think might happen there?
I mean, I've got some purists in the health department sort of community who really don't want to see sports happen because they're just a risk waiting to happen. And I don't share that view because I believe that sports and activities in general carry so many benefits that while there are risks, again, there is no risk-free path out of this. And I think we can't purely just look at the risk, because then we're not going to avail ourselves of any of the benefit that we know exists from conducting activities and sports and all of that. So I think it really boils down to understanding what are the various risks with each of the sports. And given that this is a time sort of continuum, what are we going to know about the epidemic and what will be in place as the various seasons go by? So, football is football. But what may change is when football happens. I don't know if that's on the table or not. Maybe it is. What may also change is what we know about the virus, what the current prevalence rate in the community is, whether there's a vaccine, which I will just say right now is unlikely to happen this calendar year, and what we know about transmission and the ways to mitigate the respiratory spread. I think there's got to be a smart kid in the Brighton schools right now who is going to design a face shield that can be used while playing lacrosse and soccer and football. That somebody's got to do that, because I think there's got to be a way to contain that respiratory spread to be able to allow us to conduct these sports. So my goal is to be able to have all the knowledge that we need in place to conduct every sport that we possibly can. We know that certain sports already have been approved. We know that they're relatively low risk. I think baseball, softball, gymnastics, track or cross country, there's a list of 6 or 7. Those are already out. I do think it's going to open up more. I think as we learn more, and I'll say here in this community, our prevalence right now is probably between 1% and 2%. And so that means 98% of this county can move about the county with almost no risk. The problem is that we don't know which of the 2% who has this infection is standing right next to us. But if you play the odds, having a prevalence of 2% is far safer than even 5%. To give you a sense, the highest prevalence that we had to our knowledge, of course, is sort of limited by our testing, it was 14%. At the peak of this in early April, mid-April, our estimate was that we had a 14% prevalence in this community, and that was the peak. New York City had a 20% peak, and you saw what happened to New York, and that's largely because of the density. So there's a whole lot that may change, but in answer to your question, I think I would love to see all of the sports proceed, and with as minimal disruption as possible.
All right. So in that same vein of thinking, I think, probably what's on people's mind is the idea of chorus, singing, some of the arts types of things. But in the bigger picture, part of what I'm hearing you say and some of the conversations I've been a part of is this is really about mitigating risk as opposed to eliminating risk.
Right.
So, for example, there are those that have said, okay, in terms of transportation, you could put one student per row and you could have this big space. And we recognize that that would mean very few kids on a bus, no feasible way either through the just having enough buses, enough time, enough money, enough ability to get here kids in a timely way to really conduct that kind of transportation system. So part of the discussion we've had in some of these groups has been, how do you mitigate the risk then? So maybe it's that students can ride the bus, but we do limit the routes in every way we can, so as much as possible. But then it's hand sanitizer when you get on the bus. You have to have a mask while you're on the bus. Those types of things, knowing that there is some risk to that, but it's about mitigating the risk and still being able to carry on life. Do those kind of things make sense to you?
Absolutely. And I'll tell you, I think the value of the masks is becoming clearer and clearer with every passing week. We have not seen, and I will just call it now, we will probably not see a spike in cases resulting from the weekend of protests that we had a couple of weekends ago. We didn't see anything major from Memorial Day, and we didn't see anything major from Mother's Day. And we had a whole lot of evidence of social gathering during those times. I would like to think it's because people wore their masks. And I think it's turning out that the mask is becoming much more powerful. And it may be that between now and the fall, as we learn more about this mask, we might be able to sort of relax that 6 foot parameter. It may be 3 feet, it may be shorter. And we may do studies that show that for the duration of a bus route, if you're wearing a mask and you're sitting, one per seat, the risk is not going to be 0, but it may be less than 4% or whatever. And we can tolerate that, because the other side of that is, there may be infections that are unavoidable. What we don't want is an outbreak. So if we can identify people and then take them out of school, because it's no different than having any other illness, you want to make sure that anybody who's sick is not in school. If we can identify those people sooner, we're taking a chance, there's no doubt, but we're taking a chance no matter what. But again, for what benefit? Because if at the end of the day, we can get more kids to school more efficiently and at less cost, that might be a calculated risk that we might need to take as a community.
So before we jump to the thoughts, one other thing that's been on my mind certainly too is, while we're talking about mitigating risk and those kind of risk factors and the symptoms, et cetera, temperature scanning has become something that has come up often. And it seems to me what I've also heard is that, one, the data is not always extremely reliable. You can also be carrying the virus without having a temperature. And just because we take temperatures and get that data, then what do you do with that data? What's the right number, et cetera, those kinds of questions. And the notion of even being able to efficiently temperature scan that many people in a short amount of time while they're standing then within 3 feet of each other seems to me to be problematic. Do you have a take on that at all?
Well, we've run into this already because we're trying to figure out how to do temperature testing for visitors to all the various municipal buildings. And Supervisor Maley asked me the same question. Should we check everybody's temperature as they walk in? Well, if it means that everybody's got to stand in single file line for 10 minutes, probably not. Mm-hmm. What I will say in a school is that it's harder to get a good story from a second grader about their symptoms than it is a high school student. So we're going to need to rely on either more objective data or a greater degree of parental report for the younger students, because just like before, we do not want to send anybody who's sick to school. It's probably more important now than it's ever been, and it's always been very important. But we need to rely on our parents to take that extra step to make sure that we're not sending our kids to school sick. And I understand the pressures of childcare and work and all of that hard balance, but this is a big one. And we really stand to unleash an outbreak in our schools if we send somebody who's very pre-symptomatic or asymptomatic to school. This would be something that I think we need to have some serious cooperation from our parents around.
Great, thanks. So I'm going to do two things, Mike. I'm going to record right now, and I'm going to reboot the live stream because it looks like it's not streaming well. So if you just give me 1 second, do that. And that way, if it doesn't live stream well, we can get it back up and running for people to see. You see we've got a bunch of items in the chat there too. So if you just give me 1 second. Okay, there we are back up on the screen. So I'm going to jump back to sharing my screen, and we'll start to go through some of the thoughts from the exchange for people as well. All right, so the first one I'm wondering if you can comment on, here's up on the screen. Please help us understand the current likelihood of kids in September having traditional school days versus partial on-site school days versus homeschool. As parents, workers, we need time to think about the impact the fall school situation will have upon our jobs and make arrangements over summer. This seems to be kind of a density, a number of kids issue, a scheduling or a logistical issue, but is this something that you're hearing about, maybe kids coming in for shorter sessions or pieces like that?
Yeah, I think all of those questions are on the table. And, the challenge with all of this, and I get a lot of these questions that in my mind sort of all fall into the crystal ball category. The reality is that we don't know what boundaries are going to be set for us by the state health department, by state ed, and by the governor's office. So once we have those guardrails in place, that will allow us to know how much we can change lanes, on the highway. But right now we don't have that. I think everybody wants to have as much in-person school as possible. I'm honestly thinking that that's not likely. I think we should at least prepare to have some component of distance learning. And I only say that, based on the fact that it would be very hard to implement, assuming that all of the social distancing guidelines that we know to be true now still hold relatively true in 4 months. I think it's going to be very hard for any of our schools in our county to drastically change their physical plant, purchase all the equipment necessary, all of the logistic things that would go into being able to safely have classes in a quote normal way. I think that would just be very hard to do between now and September, and that's not that far away. So I think while I'd love to have normal again, I think the better part of caution would be to plan as though there will be some element of distance learning again. And that might vary. I mean, I think it's probably more feasible for the high school kids than it will be for the younger students.
So this next comment, what is the threshold for returning to school? What would you need to see to feel good about us going back to school?
Well, this is one of those questions that's not yet resolved because, getting back to that community prevalence, if I know the prevalence to COVID-19 in this community to be less than 1%, I think we could open schools and have very manageable risks. The flip side is if it's 5% or 10%, if it's 20%, we will not open schools. That's the level of, variability there. And so it really depends on how well we can work together as a community to keep that number down. Because we're at 1% right now. Can we drive it down even lower? Yes, I'd love to see that. But we've got to sustain this through the summer, and we've got a whole lot of reopening that's going to happen between now and then. So I think that if we can work together as a community to keep that prevalence very low, the barriers to opening will be all the more diminished.
Thanks, Mike. This next one I'll jump into, and then I'm going to give you a heads up that I'm going to ask you next about the 2 or 3 things as a parent you'd want to see to feel safe. So this one, if kids cannot return to school in the fall, will the distance learning model shift from emergency online continuation of learning, as it was called in today's survey, to something else? If so, what and how will the instruction, delivery, and teacher involvement be different than it was March to June? So I did answer this one, and we'll send out answers again on Friday with the communication to families to some of the specific questions that couldn't be answered today or needed more detail. From my perspective, in terms of this, we will have a couple of different things. One, I believe you'll see more consistency and more face-to-face. We have yet to determine what exactly that will look like. We are doing professional development right now. We are assessing what did work, what didn't work from educator perspective and also from parent perspective, and trying to really develop a better sense of best practice. This was emergency crisis education that had to happen very, very quickly. We've learned a lot from that and thought about what exactly would work better. And we'd be talking about also a different time of year if we were talking in September in particular, where kids haven't been in that class with those teachers for the same period of time that they were. So it's just an entirely different set of considerations as well. The second piece beyond face-to-face is consistency. So thinking about our schedule, thinking about the way things were scheduled, the way we are assessing, the way we are delivering instruction, and the communication that we're providing. So one thing that we definitely learned in the feedback that we've gotten so far is people are looking for consistency and some more coordination between departments, between teachers and grade levels. So that's what it might look like there. A quick snapshot of what it would be, but we're doing a lot of work this summer to think through that. So now jumping back to you, Mike, as a BCSD parent, what are the top 2 to 3 things that would make you feel comfortable sending your children back to in-person school?
So the top 3 are too easy that I'll give you a 6. So the top 3 are going to be antibody testing, a vaccine, and low community prevalence. So those are easy. That's going to be true for everybody in the country. If we have an antibody test that allows us to reliably predict who among us has become infected and is now protected, that would be very reassuring. If we have a vaccine, obviously that would be very reassuring. If we have a very low prevalence in this school district, that would also be very reassuring. I think antibody testing of those 3 is the one that I think we can probably bank on the most. Low prevalence will be something that we have to work together to get, and a vaccine is just not going to happen. In terms of what would make me comfortable as a parent, more science around the benefit of masking. Because I think wearing a mask, and I understand that it has become a symbol for all sorts of things in this day and age, but I do think that at the end of the day, wearing a mask is probably one of the simplest things that we can do. And if we can have better science around the effectiveness of a mask and get those who are sitting on the fence, currently about whether or not to wear a mask, if we can get everybody into the camp where we understand the value of a mask and its limitations, I think that would make me much more comfortable, knowing that the school had hand hygiene as a priority, and it's always a priority, but we can always make it a bigger priority. And I say this as a doctor. In the hospitals, we still need to work to make it a bigger priority, and that's a hospital. So what can we do as a school community to make sure we've got sanitizer everywhere, that we take breaks to wash hands, particularly in the younger grades? And then the surface disinfection part. I think that's always been one of those things. It's never a bad idea, but we don't yet know the full benefit of surface disinfection. But when we have more science around that, I think that would make me feel even more comfortable. But I do think that, given what we know right now, if both of my children wore a mask to school, I'd be very comfortable sending my kids to school.
Great. So sign them up. We want them back.
I don't think they want to go back. I'll tell you that.
There you go. So this next thought, assuming school opens in September, what criteria will be used to determine if schools need to close down again?
So this gets into the difference between phase 1 and wave 1 and wave 2. When we closed down in March, we did not know what the community prevalence was. All we knew at the time was that it was spreading in the community, but we didn't know, honestly, whether it was 20% or 2%. The guidance from the CDC was very clear. If there's evidence of community spread, you close down a school. And at the time, we didn't know. It was Greece, Arcadia, I think, at the time. But we honestly didn't know how widespread it was across the county. So we made the decision very early. We have to do this in a coordinated way because it's not going to make any sense for Greece to close and Brighton to stay open. Fast forward, now that we know so much more about this virus, and now that we're able to test, trace, and isolate much better than we were on March 15th, my goal is not to see infections, but my second goal is if we find an infection, we're going to try to isolate that person as quickly as we can, do the contact tracing as best as we can in a school, and close down as little as possible. And by close down, I mean maybe quarantining, or maybe sending a class home, or sending a wing of a building home, or at worst, sending the whole building home. But we're at the point right now where we know enough about this virus that it should not be necessary to shut down the whole system or even a whole district. What would have to happen for us to have to do that again is if this thing went completely out of control and we had no idea again about community prevalence, or if it was so high that even if we knew about it, it would be impossible to keep people well. So I do think that we're going to have a lot more knowledge going into the so-called second wave.
So we've talked about this a couple of different ways around timing and guardrails, as you mentioned, and these discussions. This next thought gets to that. I'm wondering if you could comment. When will we have a better idea of what the fall will look like? We're a household of 2 working parents, and some of our children are not able to be alone. We're currently working from home, but that won't be forever. From my perspective, we're looking for those guidelines and that work to happen. We're participating in that discussion. I know you're very involved in those discussions also. We don't have a great sense of when some of the guidelines might come to us at school, in schools, and think that that work will be done in July, being able to communicate at some point towards the end of July, beginning of August. I don't have that on great authority. That's what I'm thinking right now, and I don't know what your thoughts are on that.
I think the amount that we're learning with every passing week is going up. As we reopen with these phases, we're learning a lot. Intentional or not, we're learning a lot about the transmission of this virus. And I think with phase four will be the hardest one. There's the greatest amount of variation among the phase 4 businesses than there has been in phase 1 through 3 combined. So when we open in phase 4, which could be as early as the end of this month, we'll learn a lot. I think honestly, if we were able to open, most of the phase 4 activities, by the end of this month or in early July, by mid-August, we should have a good sense of the effectiveness of masks. We should know what the impact, if any, on community prevalence will be. And I think by mid-August, we'll probably know everything we're going to need to know to make a decision to open by September. Now, that may not be enough time. I understand. That's leaving you very little time between, that day and opening of schools. But I think that there's still so much that we have to learn, in order to do this safely.
Great. So what protocols, this person is wondering, might be in place or will be in place to address symptomatic individuals coming to school? The other issue that's come up in some different questions that I've been asked, not just about symptomatic individuals, but people have asked questions about, well, if somebody comes to school, turns out they are sick, how long would they have to stay out? Would then the whole class stay out? You just mentioned some of this. And then this whole issue of, how do we determine who has to come, who doesn't have to come? Would that be optional? Will people have the option either as an employee or as a student to stay home? Any thoughts on that?
Yeah. So first of all, let me just address that we're believing now that upwards of 40 to 45% of cases occur in people who have no symptoms. The transmission occurs between people who had no symptoms. So a lot of people are getting the infection from people that didn't know that they were sick, is the point. And the challenge with that is that you don't know who is asymptomatic positive or just well. What I would say is that, we shouldn't be sending symptomatic people to school ever. And I understand that a little stomach ache isn't necessarily contagious, and a lot of kids go to school with a stomach ache. So my hope is that between now and then, we're going to have a better sense of how to more accurately predict COVID based on the 7 symptoms that we're asking about today. Because right now, if you ask, most children those 7 symptoms, everybody's going to answer 1 or 2 positive to some of them. We're going to have to be more refined in our ability to screen reliably out those kids who we want to exclude from school. Now, these are symptomatic people. These aren't necessarily COVID. These could be sick for other reasons. But in general, fever is not something you want to send a kid to school with. So that's something that I do think that we need to be more diligent about. Now, when we identify somebody who is positive, we have the authority by public health law to keep them in their house. And that goes all the way up to using law enforcement, which we obviously don't want to have to do. And the time is based on the assessment that we will conduct with that individual and their family, and when they believe they contracted the infection and all of that. But when it comes to issuing an isolation for somebody who is confirmed or sick, or quarantining somebody who's at risk, that's not optional. So the schools have no authority to overrule that when the health department, or in some cases a primary care physician, makes that call. That's essentially not negotiable.
Great. So this next comment, maybe both of us can chime in on this. How much of our plan to return to school will be dictated by the governor or state ed department? I'm not sure that either one of us know. I can only speak for myself. I've been pretty candid with people in this community about the fact that there is a Reimagine Commission that is studying this issue very actively. Sent the testimony that I personally provided to that out to the community and have participated in their discussions. There's also, and that's done by the governor and his staff. And there is a chancellor's reopening commission. So the chancellor of the Board of Regents reopening commission. And Dr. Baker and I both participated in that this week and are a part of that conversation also. There's a little bit of, I'd say, political process happening between the two groups and how that's going to work. And people, I don't think that's any secret across the state in a lot of different ways. There are interesting paths to which these decisions are being made. And ultimately, the governor, because he has the ability to do so through actually next April, can do quite a bit through executive order across the entire state. It'll be interesting to see how that plays out over the next couple of months. I don't know that either one of us know. I just, again, know that I know it very hard to tell. The governor is generally making these decisions and doing things through executive order is my impression.
Yep.
And I can't say how much is being influenced by the state ed department or the state health department, for example. Dr. Mendoza might know better.
Yeah, I think along the same lines. I think in answer to the question, how much of it is dictated by the governor or state ed, at some level, all of it is dictated by the governor and state ed. That being said, if how we've reopened is any predictor for the future, the way we've reopened so far is, open the door a crack, see how things go, and if things look okay, open it wide open. The more recent example I can offer is, as of yesterday, the governor said that visitation to hospitals and group home facilities will be permitted. But then he laid out a whole bunch of guidelines around that. And so the hospitals are working feverishly, and it's going to take them a week to figure out how to apply those guidelines to the individual hospital system and the individual hospital. I think it's likely that reopening schools will follow along the same theme, where he'll open the doors figuratively, and he'll lay out some guidelines. But at the end of the day, it's gonna be up to us to figure out how do we apply those guidelines to French Road Elementary School, because the governor can't know how many doors there are at French Road Elementary School. So we're gonna have to figure out as a community, what's the indoor and what's the outdoor, for example. I mean, those are the kinds of details that I think nobody's going to be able to give to us. And so this is why I'm hoping that we'll get guidance as soon as we can, because there's gonna be a whole lot of planning that's gonna have to happen between now and then.
You bet. So there was another comment. We're now getting into the territory where most is probably going to start to get repetitive, and it's just different ways to ask the same question. You've covered so much. One thing that you mentioned earlier on when we started the conversation was about the fall and what that might look like. Could you maybe just theorize for us or predict maybe what could happen in the fall? What are we thinking about, New York State-wise, Monroe County-wise, nationwide? Where could this go?
So this sort of gets into this whole idea of the second wave. And, if you look across the country now, there are a whole lot of people who are writing about the second wave happening. Nobody is having a second wave right now. Right now, there are people who are messing up the first wave. So they are reopening before they had any indications that they should be. You're seeing this in Florida and Texas and Arizona, and primarily. Their numbers never went down enough to be able to reopen safely. I think New York, we were the epicenter at one point, but we flattened the curve and we've turned the numbers in the other direction. So if there was a second wave to happen anywhere, it would be in New York, because we've already passed the first wave. So anything that happens in New York State between now and the end of this pandemic, where the numbers turn back up again, that would be our second wave. And what is unclear is the impact of temperature and seasonality in this epidemic. People used to say, well, warm weather and UV radiation from sunlight was going to be protective. I don't believe that to be true, since Arizona is a hotspot, literally, for this epidemic right now. So I do think that dry air and cold air, though, can accelerate this. That's typical for coronaviruses of other types. I believe it to be true for this particular coronavirus. I think that is what could open the door to a second wave in the fall and winter, coinciding with, unfortunately, flu season. So what I would say is, now more than ever, very important for everybody to get their flu shot this season.
Good reminder. Another comment that came up here is, even after a workable vaccine is made, how long will it take us all vaccinated and back to normal?
That's anybody's guess. What I've seen so far with the vaccine timing is that it's unlikely to happen this calendar year. I think most people think it's going to be very lucky to be in place a year from now, next summer. When a vaccine is in place, the way it's always happened before is that there are priorities that are set. And typically it's going to be for older adults or whoever is at more risk from the particular illness. That may include very young children. We had this sort of spat of the multi-system inflammatory condition that, I think the interest in that is sort of waning a little bit, but I think the jury's still out to some degree. We know for sure that older adults are at much greater risk. So frankly, if I had to choose, I would be vaccinating adults 70 and older before, adults between, 40 and 70. So that I think is what's going to happen because, in the early months of a vaccine, the supplies are always constrained. But obviously once there's enough available, we're going to want to make it as universal as possible.
How about this, do you recommend kids playing in small groups outdoors, wear masks in Brighton? Many parents are unsure of what is necessary during outdoor play.
Yeah, this is a common one, and we encounter this as a family. Part of this gets into the three things: the proximity, the activity, and the duration. But then the fourth element is who are you playing with? And this gets a little awkward to some degree. But if you have any way of knowing if the other family has been abiding by social distancing and to the degree you can assess their rigor with sort of taking the appropriate precautions, I think that is something that you have to think about. The fewer the kids, the better, because then you have fewer kids you have to worry about. But I hate to make the analogy, but this is not unlike sexual activity in college. When you have a relationship with one person, and you got to think about all the other people that person was with. It's not that different when it comes to a communicable illness of any kind. And to some degree, the COVID-19 sort of plays out that way. So we do have to think a little bit about the families and the other people in the group.
Great, thank you. There's one up here I'd like to point out before we go to the comments on Facebook. Kudos to Dr. Mendoza. Thanks for your leadership. Happy to have you in Brighton. And another great comment. Thank you, Dr. Mendoza. Brighton is lucky to have you in our community. I hope the state and local governments seek and take your counsel. I couldn't agree more with both of those. I'd give it 5 stars over and over and over again. You've been a really great partner in all this. So it's much appreciated by myself and all the other superintendents I know.
Thanks.
All right, so let me just transition here to pull up some of the Facebook comments and check those and see where that leaves us with everybody. Refresh that video one more time. Keeps coming in and out. If anybody missed the counting of the vote and is tuned in incorrectly now to this broadcast, hopefully we've been more exciting than that. So let me pull up some of the Facebook comments.
Oh, there you go. Oh, this one here, 38 comments, that one.
Yeah, there we go. So I'll start to click through those. So when we start right up at the top, yep, Danielle talks about kids being sick all year. Susanna Hacker passing on the link as well. Mary Kay Whitback pointing out hand hygiene will improve those odds. Certainly something Dr. Mendoza has pointed out. Also, Rebecca Rauscher, what availability is there for antibody testing locally? That's a great question for you to answer. And one other one that was in the exchange is, will kids who become sick be required to be tested before coming back to school? Is that something you could see happen? So antibody testing and then just testing overall, if you could expound on that.
Sure. So just to recap, there are 2 tests available right now. The first is the viral test. That's the one that you would take. That's the nasal swab test that you would take to determine if you're sick right now. The challenge with that test is that we think in the first 5 days since your exposure, that test is likely to be false negative. So it's not good enough yet to detect somebody who's asymptomatic or even symptomatic, confirming that they have COVID in the first 5 days of illness. And that has to do with the test properties of this particular lab procedure and so forth. So diagnostic testing, people will say, well, just test 3 times a week. The reality is that there's always a little bit of delay in that. And obviously testing 3 times a week is just prohibitive. So that's the diagnostic testing. The testing that we really want to look at is the antibody testing, because that's the get out of jail card, so to speak. If you're antibody positive, the assumption is that you're protected. Right now, none of the tests that are available have been FDA approved. So, we're using them in limited, circumstances in the hospital, and I'll get into that, but they currently don't allow you to have with any great certainty the confidence that you're safe. I think that between now and the fall, that is going to change. So now, do we institute a process where we, antibody test everybody? It's going to depend on the properties of the particular test and the benefit. There's a lot of people who say, I know I was sick in March and I had all the symptoms, and we test them and they're negative, because we know that the prevalence even in March was relatively low, and in February even lower than that. When did it start in Monroe County? Nobody will really know, but I think come September, my hope is that we'll have a better antibody test, and more importantly, we'll be able to say something about the result. So right now, if you have a positive test, we really can't say that you're even protected at all. And we can't yet say for how long you will be protected, because we just don't have enough experience, unlike the measles antibody, where once you're positive, we're pretty confident saying you've got, 7 to 10 years.
Right. So Melanie Ryan here is asking, do you anticipate that there will be an option for families to keep kids home if parents have health conditions that put them at risk, and which conditions are currently considered high risk?
That is a tough one. I think that's going to have to be a decision that's made in concert with, primary care physicians. That's not something that the health department's going to be able to weigh in on, or should weigh in on. I think age is frankly a much better predictor of poorer outcomes than other health conditions. Now, obviously, age and other health conditions go hand in hand when you're 70 and 80 and 90. But I think that is a good question. So let's say a parent in their 40s has lung disease, or is a transplant patient, or is on chemotherapy. Honestly, that would be a reason for me as a physician to at least make the recommendation to the school. You might want to consider having the son or daughter stay home. That's uncharted territory. That's not something we've typically done in traditional medicine, but I think that is something that we're going to have to keep on the table, particularly until we know more about the risk of transmitting and the prevalence of asymptomatic spread from kids. One of the big questions that we still have unanswered is, what is the prevalence, or how much are children the vector for asymptomatic spread of this illness?
Ivy's asking, why not adopt more comprehensive testing as seen in Wuhan in Germany? Other tests such as RT-LAMP have comparable sensitivity to antibody tests and can be multiplexed. RT-LAMP is also FDA approved. This can also be followed by an antibody test to confirm. I'm not a useful doctor. You'll be far better at answering these questions. What do you think?
Well, I'm going to try to not get political, but the reality is that, the United States has been, quite a bit behind other countries with regard to testing. And that is an area where I think we're still behind, and we're hearing signals from the federal government that say, well, if you test less, the infection rate will go down. That's like saying if you look both ways across the street less, you will not get hit by a car. It makes no sense. Unfortunately, that's sort of the language that we're hearing. We're behind as a country with regard to testing, no doubt.
Somebody did ask about antibody testing and the availability locally. Somebody also posted about the fact that if you give blood at the Red Cross, they will do that for you for free. Thoughts on that?
Yep. So the one area where we think the antibody test is useful is in people who know they were positive, who were confirmed to be positive. They want to be able to donate plasma for therapeutic trials or for therapeutic interventions. That is the one indication that Strong Hospital, for example, is basically saying you get an antibody test no matter what, if you're in that category. Now, that's not a lot of people, 2,500 people, but that is the one place. As far as antibody testing goes, I'll share with this audience, we've got a Walgreens in an undisclosed suburb that's not Brighton, where they are communicating the results incorrectly. So they've communicated negatives to people who we learn later are positive, and vice versa. So I think that is happening in a couple of instances, not that egregiously, but my caution is be very careful about antibody tests that you're getting outside of healthcare settings. There are tests that are available. They may cost you a significant amount, But I think the bigger problem really is that their utility is just unknown.
So I'm going to make just a couple comments. I'm going to ask you if you could think, Mike, about anything else that you wanted to add or that you felt like we didn't get to. I know you'd gone through the comments ahead of time, the thoughts ahead of time, and then let people know on Facebook right now. There's 176 people actually on right now. If they have any other thoughts, anything else they want to put in, we're pretty close to wrapping up. So now would be the time. It's clear to me based on the thoughts in the exchange, the conversation today, but the feedback that we've gotten, just to very broadly say to our community, they would like us to communicate with them as soon as possible. And so I know that, and as soon as we do have a better sense for where we're heading, we will let people know, number one. Number two, they would like to be engaged in that conversation. They would like to provide feedback. They'd like to give input, and we will find ways to do that. So you'll see an announcement from me in the next day or so about our blueprint work coming up. We will be focused on that and diversity and equity in sort of a transitional blueprint into this coming year as our primary focus. And we'd invite people to be a part of the conversation that way. But also during the summer, I anticipate other opportunities for that. So that's very clear to me. And that answers several of the thoughts in the exchange about giving feedback. And then with regard to online learning, people are asking for a different plan, a ramped up plan. If we know this is where we're going, use the summer to plan and to think through that. And I'm committed to that. I've said over and over again, I'm so impressed with the way our teachers worked through this current situation, so we can learn from that now and build on that. And so developing a better plan going into September is certainly priority number one for us, and we will do that for sure. Any other thoughts that you had that you wanted to share, or things that we didn't get to from the exchange?
I think the largest theme here I want to convey is that, you know, the biggest challenge around this epidemic has been managing the uncertainty and figuring out how as a community we can find some semblance of security amidst a situation that is fraught with uncertainty. And part of my job is to be frank about the things that we don't know, and to tell you the things that we do think we know. But at the end of the day, you know, it really boils down to our ability as a community to heed the advice of officials across the country. And to the extent that we are, you know, legitimate here in the county, us, you know, it really boils down to how well can we do this? You know, there's a whole lot that we don't know, but there's a whole lot that we do know. And, you know, when I look at these maskless crowds that are protesting, I just think to myself, we're one person away from an outbreak, and you don't want to be that person. I think there are a lot of things that we don't know, but we do know that masks make a difference. I really want to, if I could leave you with one message, it's please, let's try to make the mask a normal thing. And I know it's not normal, but we've got to find a way to make it normal, because that's ultimately how we're going to get ourselves through this. Nobody wants to go back to those days of March and April. And frankly, I think if we had the benefit of hindsight and we could say we could have prevented all that if we had all worn a mask in February, I think we all would have worn a mask in February. So I guess that's my advice. Pay attention to the guidance. You know, we're learning as much as we possibly can. Follow us on Twitter, Monroe Health or Dr. Mike Mendoza. We'll put out all the evidence that we possibly can. But our job is to honestly be transparent about the things that we think we know, and more important, the things that we're still learning about.
Great. What about large crowds? Do you see, I know the governor said graduations up to 150 could happen. I'm hearing that that limit might get pushed in the weeks after that. You know, it'll be too late for our situation. But do you see larger crowds being able to gather later in the summer if there's masking and distancing?
I do, because I think we're learning that large crowds can gather and not have any negative consequences. You know, the protests are not a great example, because what I think saved us with the protests was masking when possible, but it wasn't 100%. But the fact that people were passing by, you know, while you're walking and so forth, you're not sitting in close proximity with strangers for an extended period of time. The one other point that I will bring up is that outdoors is way less risky than indoors. So outdoor anything is going to be much less risky than the same thing indoors. And so I was talking to the leadership at the RPO, and I said, if you had a way of conducting a concert outdoors, that would be much less risky to your musicians than to do the same thing on the stage of the Eastman Kodak Theater. So that's the kind of thing that we're trying to entertain going forward. But I think, honestly, graduations of 250 or even 300 done the right way could be very safe.
Great.
But that's the governor's call.
So hopefully in August, we can invite the RPO maybe to perform at a graduation for our kids.
There you go.
Better late than never. A couple other real quick ones here before we wrap up. Somebody asked, does the presence of antibodies necessarily mean that you're immune? And do you know the duration of the immunity?
Traditionally, it does, but for this one yet, we don't know because we haven't done the science. The usual interpretation of antibody positivity is that you're immune. The usual duration depends on the virus, but in both cases for COVID-19, we don't have that science back yet.
Great. And then there were a couple other questions particular to school types of things. Can teachers Zoom lessons so people can essentially do a hybrid approach? And a question about lab work and rotating kids in and out. I think those things are all on the table to Danielle and Tina. Those are the types of solutions that we certainly are thinking about. And then Dr. Mendoza, you should know lots of thank yous in here. I extend my thanks to you as a dad in this district, but as a colleague, it's been nothing but a pleasure. So thank you for the partnership and taking the time today.
And thank you for inviting me. Let's keep the conversation going.
You bet. We'll do it again. Thanks again. Have a great day. Take care.